Hello, I'm Tian Wei, and this is World Insight. We begin today's program in the city of Wuhan, once the center of the outbreak in China. Wuhan is moving away from an emergency mode in its epidemic control since April the 8th. Since the start of COVID-19 outbreak, the National Health Commission has dispatched several medical teams to Wuhan. One of the most prominent was a high-level team that confirmed in mid-January human-to-human transmission was occurring in China. Dr. Du Bin is one of this 6-member expert team. Together with some of the other top epidemiologists like Zhong Nanshan and Yuan Guoyong, they work hard on curbing COVID-19 spread in this country. Earlier, I talked to Dr. Du Bin, director of the Medical ICU from Peking Union Medical College Hospital. He arrived in Wuhan on January the 18th and did not leave until last Sunday. He shared his experiences on what we have learned from ICU operations in the epicenter. Could you help us to understand how is ICU now in Wuhan, the patients there being taken care of?
Here in Wuhan, we still have the, I think, 3 designated hospitals that with the patients with COVID-19. I mean, critically ill patients with COVID-19. And although these patients were already negative for PCR test of the novel coronavirus, but however, we are still treating them for the underlying diseases such as the leukemia, lung cancer, or cerebrovascular events such as stroke, either hemorrhagic or ischemic stroke. The total number of the cases in the ICU around the 10 something to 20. So there are, I think the local healthcare resources are enough to care for these patients. So that's why it's time for us to leave Wuhan.
The COVID-19 is going to have an impact on almost all major organs of the body. So for someone who is working in an ICU, critical conditions of the patient, how would you be able to work on all these very different fields all at the same time?
It's a tough question. Yeah, it's very common for us, the intensivists, ICU doctors, to take care of patients with multi-organ failure. But however, there's always 1 or 2 major causes of the multi-organ failure. So when we look at the treatment we provided to these patients, that we can divide it into either the, the definitive therapy, which is the targeted therapy of the primary causes. For example, for viral pneumonia, for bacterial pneumonia, we'll use the antiviral agents or antibiotics to treat the infection. This is what we call the definitive therapy. On the other hand, we also implement several, life-sustaining treatment or supportive therapy to correct the hypoxemia, to correct the, other organ functions such as circulatory shock, such as the acute renal failure. I would say this is a common task we have performed in the daily work in the ICU. So whenever we are treating critically ill patients with COVID-19, we're still doing the same.
About the fatality rate among all the ICU patients in Wuhan, how is it compared to the other numbers we have seen in other countries? Is it fair to compare, Professor?
As to the case fatality rates, especially comparing the data from Wuhan to other cities or even other countries, is very difficult for us because the overall, as far as I know, the overall case fatality rates in patients in the ICU, is approximately 40 to 50% or even higher, depending on different cohorts. And I think you may find exactly the same results, across the different countries, either China or Italy or Spain or even the States. which means that whenever we have a case, very severe one, treated with mechanical ventilation, with the complications such as shock, such as the acute renal failure, the half of patients will die, ultimately die. So pretty the same. Wherever you're talking about patients. But however, it's not such an easy thing to directly compare the case fatality rate from one country to another, because number one, the age of the patient population, as well as the comorbidities are quite different. So in some of the countries, which have a much more aging population, which also means that these patients may have more comorbidities or underlying diseases than other countries, so they might have a higher case fatality rate.
Got it.
The second is that the case definition is not exactly the same all across the countries, because some of the countries even included asymptomatic patients, which is not the case here in China. And the third, even we are talking about that making the diagnosis depending on the PCR test. We know that the different manufacturers may produce different, PCR test kits, and we know that the false negative results is extremely high. I mean, for the PCR test for novel coronavirus, is extremely high. So, which means that whenever you have a patient with a negative PCR test, might turn out to be a positive whenever you use a test kit from another manufacturer. And another important thing is that I can think about is that the treatment plan might be different, and the overwhelmed healthcare resources might be different. Even the duration of the overwhelming might be different, depending on the government efforts. But however, we should also point out that at least in Wuhan, that during the initial phase, whenever we do not have the capability to test everyone, that some of the patients may go undiagnosed, either to recover from the illness or die from the illness. So this is the hidden, I should say this is a hidden number of the disease. So all these, the above factors may play in a role in the simulate different or similar results with regards to the case fatality rates.
All right. Well explained, Professor. May I follow up on some of the points you just mentioned? First of all, about the failure of PCR tests. And as a result of that, how should we understand the current process of testing and also the current data coming from all countries?
Probably I'm not the right person to provide the answer, but however, as far as I know, the false negative rates with regards to the PCR test for the novel coronavirus here in Wuhan is approximately 50%, or
That's
even higher.
50 you're talking about,
some of
isn't
the
it?
reports, case series.
Yeah.
Yes, 50, yeah, 50%. And there are multiple explanations for this. The technique of the sampling and the site of the sampling, because even in the guidance issued by the Ministry of Health, that they recommend that you should sample the lower respiratory tract, which means that you should obtain the sputum of the patient. But however, as far as we know, that majority of the patients, especially during the initial phase, they only developed dry cough without sputum. So which means it's very difficult for you to take the sputum of the patient. So in some of the cases, we have to perform the nasal pharyngeal swab or oral pharyngeal swab instead of the sputum for sample.
And therefore, when you heard about those who want to be tested will be tested, will those campaigns be able to really help policymakers be able to make the right decision?
The only way to stop, as far as I can see from our experience and from the experience of the other countries, the only way to stop the pandemic is that we should know who is the patient, who is the close contact, and so that's so That's why I should say test is the only way, the only approach. Although it may have the false negative or even false positive results, but this is the only way.
Yeah.
We know that PCR is not perfect, but anyway, the serology test, which is the test for antibodies, might be a supplement, good supplement for the PCR test. But anyway, whatever methods you use, you have to tell who is the patient and who has the capability of transmitting the virus to other, healthy subjects.
Right.
That's the only way, and you can isolate those patients and prevent the disease from spreading to the community.
Dr. Du Bin, thanks to concerted efforts by frontline medical personnel and experts like Dr. Du, the daily life of the one-time epicenter Wuhan in China has gradually normalized. And Dr. Du, together with his team, which has been in Wuhan since mid-January, have finally left the city. But he is not going back home in Beijing. Instead, since imported cases have been flaring up while domestic transmissions have been controlled, he is heading to northeastern part of China, where he is on a new mission. What's likely to be the situation that you are going to face there?
Well, I do not exactly know what is our responsibility there yet. But however, according to my knowledge, the number of cases, especially the severe cases in Harbin, is not so much. So which can be managed by the local healthcare workers, including the intensivists there. And the same thing happened in Suifenhe, and they have the most critical patients hospitalized not in Suifenhe but in the Mudanjiang city, because it's we have several city hospitals and tertiary hospitals there to provide better medical care for the patients. So currently, I think the current situation is not the surge of the critical patients in Suifenhe. Is that we just make preparations for the coming. We are expecting the customs to open to the Chinese citizens who are still remain in the territory of the Russia, and so whenever they come in, we may expect more cases of COVID-19, including the mild cases and the most critical patients. So we are right now making preparations with regards to the administration, management, and medical care. And the purpose of our visit to Mudanjiang or Suifenhe is not only applicable to the situation there, but also in Manzhouli. Because Manzhouli, of course, all the way other directions, is another important city with facing with the similar situation as in Suifenhe.
Both Suifenhe and Manzhouli, of course, are sitting on the border between China and Russia. Having said that, though, Professor Du, you were a member of the high-level expert advisory group of the China National Health Commission. Now, that group has played a crucial role in determining human-to-human transmission, whether that exists, to what degree, and also a crucial role in the decision of whether so-called to lock down Wuhan. Tell me more about your earlier time experiences.
In my mind, is that the so-called high-level expert team only existed for 2 days.
Yes.
And we spent a whole day here in Wuhan. I think that's on January the 19th to have an interview with the local healthcare authorities, as well as to visit both the Wuhan CDC and the Jiantan Hospital, which is one of the two designated hospitals at that time for patients with COVID-19. When we stayed here, we had the conclusion that the disease was a human-to-human transmission, with a disease with the capability of human-to-human transmission. But however, even that kind of the conclusion was made even without the information from Wuhan, which means that we have two experts from Guangdong province. One is Professor Zhong Nanshan, one is the Professor Yuan Guoyong. Both of them knew a family cluster, which was in Shenzhen, I believe, that a patient, an index patient, went back from Wuhan to Shenzhen and transmit the virus to the family members. This is a signal to us that this is a human-to-human transmission disease. So even without the information provided here in Wuhan. So during the interview with the local healthcare, both the Wuhan and the Hubei province, we know that there are some hospital-acquired infection happened here. So this is a confirmation of our previous conclusion. So this is a very easy conclusion to make. And with regards to the recommendation to lock down the city, which is not obviously not a decision on our level. No. It's a decision made by the government. But however, we do make the suggestion that you may encourage the people, the general population here in Wuhan, not to leave the city, and you should also recommend the people outside Wuhan not to come here. So that's one of our suggestions to the government. That is during the report to the central government on January the 20th. So when we were in Beijing, we raised the suggestion.
Now, there is a danger, Professor Du, you know better than I do, of the winter coming back, of the virus, another wave, if not managed well, even over the next few months during the summer and the autumn time. So with so much unknown, which is wonderful that we don't know them, therefore we want to know them, but still that means unpredictability. What kind of danger are we facing, Professor Du, frankly speaking?
Currently, we have no idea whether the patient, the virus, the novel coronavirus will come again, and whether it will come back with such kind of the significant impact, or it may just go like the regular flu. I think we should still wait and see. But however, I do believe whenever there is a possibility that every government might have a better preparation from all levels, all aspects, to prepare for the next surge or next outbreak.
We hope
whenever it is in fall, in the winter or next year.
We hope so.
Yeah.
Professor Du, I mean now you're only, if I look at the watch, you're setting off 2 o'clock, leaving Wuhan. Have you take a good look at the city? I mean, what is it like for you, Professor Du, after all of these days, and all of these days with life and death on the verge?
The past 3 months, or 100 days, is the longest day. It's the longest duration I've been away from Beijing, where I worked. I was born and lived and worked. So it's a strange feeling, to tell the truth. Whenever this is a time for me to leave. I still remember the afternoon on January the 18th when I first came here. I mean, to cope with the outbreak, and which is a cloudy afternoon. But right now it's clear, it's sunny, and it's warm. We know that the city, there are a lot of changes in the city after the previous 3 months. I mean, at different levels. The city management, administration, the hospital, the local healthcare authorities, the hospital administration, and even the healthcare workers, as well as the general public. I think this outbreak, which is already at the end of it will have a great impact on the human behaviors, on the living habits of the local people. I do wish, and more importantly, I think I love the city, and I do hope to I mean, in the future, and I'm pretty sure of it, I will have the opportunity to visit the city again, to visit the hospital. I've been working here for the past 3 months, like Jintan Hospital, like the pulmonary hospitals, like the Zhong Sino-French City, New City Hospital. Yeah, I would love to come back, to have conversations, to meet with the the healthcare workers there, and even some of the patients. Yeah, to see what is going on with them. It will be a nice memory.
Yes, absolutely. Professor Du Bin, one of the top ICU experts from China, who started his work in Wuhan, the epicenter of COVID-19, since January the 19th, and never left that city until last Sunday.